In the last year and a half, COVID-19 has pushed hospitals across Texas to capacity, leaving frontline workers exhausted. But throughout the pandemic, those workers also faced the threat of violent assaults in their emergency rooms. Investigator Kelly Wiley reports why prosecutors say many times their hands are tied when it comes to prosecuting these cases.
Throughout the pandemic, the Austin Police Department wrote incident reports on more than 60 alleged assaults on EMS workers, medical staff, and security at hospitals across the city. In one of the cases from January 2021, court records describe how a nurse at North Austin Medical Center was allegedly punched in the face by a patient. Police say the suspect was there on a mental health hold. The Travis County District Attorney's Office dismissed the charges in the interest of justice. Dr. Serena Bumpus is a practice director for the Texas Nurses Association.
These incidents happen, unfortunately, they happen daily inside our healthcare facilities. There's also mental health issues that exacerbate the workplace violence incidents as well too. Substance abuse is another reason why those occur from time to time.
In Austin, many hospitals are authorized to perform mental health evaluations for police. We asked the district attorney's office why they often end up dismissing or rejecting charges against people accused of assaulting medical staff. The DA's office said in these difficult cases, we also have to consider whether the person is competent to be prosecuted or can become competent, and whether the person was sane at the time the crime was committed. In the last legislative session, State Representative Donna Howard, a former nurse, introduced a bill addressing assaults in healthcare facilities. It would have required hospitals to treat staff after an incident and track those violent attacks. But the bill failed.
There's this cycle that a mental health crisis brings a patient in, that patient assaults a nurse or another member of the hospital staff, and then that case gets rejected by the district attorney's office. Does the bill you put forward solve that issue?
I wouldn't say it solves the issue. I think what it does is ensures to nurses and others in the healthcare facility that they are valued, that we want to put policies in place that will protect them, and that we want to keep records that can be used if they need to be used in order to support cases. You know, when we're talking about the mental health issue, I think that's going to be still a constant balancing act we have to do in order to not stigmatize.
We want you to know we reached out to several hospital systems in Austin. We were asking them if they already have prevention plans in place and if they're already tracking these assaults as they're happening. So far, we've only heard from Baylor Scott and White. They say they have workplace safety programs in which they treat and train their staff in prevention, in recognizing these assaults, and in reporting them properly. They say they also have emotional support resources, but they haven't yet answered the question for us as to whether they are in fact tracking these assaults as they are happening as a health system.
Kelly Wiley, State of Texas.
Thanks, Kelly. There is also a push underway in Washington to protect healthcare workers from violence on the job. In April, Congress passed the Workplace Violence Prevention for Healthcare and Social Service Workers Act. The bill would require hospitals and other treatment facilities to create violence prevention plans and improve how they investigate incidents. The legislation is currently waiting for a hearing in a Senate committee. Thank you again for joining us for State of Texas. I'm Josh Hinkle. We'll be back next week to bring you an in-depth look at Texas politics.